All right, we're going to focus on neoplasms here. So some terms we need to make sure that we're familiar with when we're talking about neoplasm is the fact that it means new growth. Okay, so the word neoplasm means new growth. Tumor is another term we need to know. It's a swelling or a neoplasm, so it's a collection of that new growth that's present. Leukemia is a malignant disease, specifically of the bone marrow. Okay, so it's kind of like a type of blood cancer in the sense that it is going to deal with the bone marrow. And then we have hematoma, which means bruise or contusion. All right, so a hematoma is kind of like a large bruise or contusion. We want to look at some classification of neoplasms. So we have here cancer. Cancer is a general term, but it's for malignant tumors or neoplasms. So malignant tumors are kind of what causes it to be considered a cancer. These get classified according to a couple of things. For one, it's the appearance and the growth pattern that's being seen. Okay, what do the cells look like? How are they growing? Are they starting to spread and move out of its kind of normal area? And also the type of body tissue from which they arise. Okay, is it coming did it start in the liver? Did it start in the breast tissue? Did it start in the prostate? All right, they're going to be looking at what type of body tissue it arose from. So when we look at this, we kind of have a flow chart here to take a look. We have neoplasms, and we see that benign neoplasms are going to be a growth that's more contained, which we're going to talk more about in a minute. Then we have the malignant neoplasms, and this is what we consider cancer. And they're going to get named based on their kind of tissue of origin, classified based on their tissue of origin. So if it came from like epithelial type tissue, a lot of times they're known as carcinomas. If it came from connective tissue, it's sarcomas. And then, of course, if it came from the bone marrow, we call that a leukemia. All right, so they can be sometimes even subdivided based on their kind of tissue of origin. So guys, with epithelial tissue or the carcinomas, these are going to come or arise from epithelial tissue like your skin or glands. It's the largest group of malignant neoplasms, and it's going to indicate that that tumor came from epithelial tissue, and that could be on the outside of your body, like with your skin, or it could be on a internal body surface, because a lot of your internal organs, especially if they're hollow, are going to have an epithelial layer. Now with connective tissue, it being a sarcoma, this is going to normally originate from bone, muscle, or fat. It's a benign tumor of the connective tissue, such as the bone would be like an osteoma. Okay, so we would put that oma on the end there. If it's a malignant neoplasm, it's called an osteosarcoma. Okay, so the sarcoma would be added there to tell you that it's malignant. The osteo would tell you it is the bone. Sarcomas are less common than carcinomas, like we saw with the epithelial tissue, but they tend to spread more rapidly and are highly malignant. Okay, so they spread quickly and they spread to far off places very easily. When we look at the leukemias, we also see that that could be the lymphomas. These are malignant neoplasms of the lymphatic or blood forming organs or tissues. When we look at this is going to deal a lot of times, like we talked about, with the bone marrow inside of the bone. These malignant neoplasms do not have a benign counterpart. They are completely malignant. Okay, there is no benign counterpart like we saw with epithelial or connective tissue. All leukemias and lymphomas are malignant, but their prognoses can vary. Some are going to be where the patient may live a very long life even without much treatment. Other times it's very life-threatening. All right, so very wide range when we talk about leukemias and lymphomas. All right, so let's take a look at, again, a little closer at some of these terms when we talk about benign versus malignant. So guys, a benign type of tumor is going to be classified based on its appearance and its growth. Again, just like any kind of change that we start to see, we're going to look at the appearance of the cells. We're going to look at the growth of the cells. We do find that benign tumors are confined to a local area. They have not spread. Okay? They are not malignant. This is why we call them benign. And a lot of times they're encapsulated. They have a capsule around them that helps keep them contained. So they do not spread, and they're commonly called tumors. And these guys are usually harmless. Now, of course, it's going to depend on what tissue they're part of and their location, because as they grow, they might put pressure on something that obviously would cause some issues. But the actual growth themselves of the tumor that's present is not really harming you. It's when it puts pressure on nearby areas or nearby tissues where they become more of a problem, whether that's on nerves or blood vessels or glands, things like that, where they might start putting pressure. So benign tumors, if you were going to have a tumor, benign tumor would be the one that you would prefer. On the other hand, with malignant tumors, again, we are going to classify them based on their appearance and their growth, but we do see that they start to look a lot less like their tissue of origin. Okay, a lot of times with benign tumors, we can really be able to see exactly where that tissue of origin was, not only because it's right by that location, but the cells still resemble the tissue it came from. Malignant types of tumors don't always resemble the tissue they originally came from. Malignant means deadly, and so these types of cancers or tumors are going to spread very quickly. They're going to spread out from the area where they started, and we see that there's going to be an invasion that takes place where they spread to surrounding tissues, and a lot of times they'll have these kind of extensions, like crab-like extension or legs that are go through the tissues, and that's what makes it really hard to remove these tumors a lot of times, because they have these finger-like extensions throughout other neighboring tissues. If it has spread to distant areas, we say that that's metastasis. Okay, it's metastasized. This means it's spread to a distant area. So it might have started as liver cancer, but now there's some cancer in the kidney, and it originated in the liver. All right, and so we see that it can travel a really long distance. Now, another thing that malignant tumors are really good at doing is they actually cause a new growth of blood vessels into their area. We call this angiogenesis. These tiny new blood vessels grow into the extensions in the tumor itself to supply it with oxygen and nutrients, the stuff it needs to create ATP so that it can continue to grow. A problem too, though, like we talked about with those extensions, making sure we get every part of them, these tumors tend to bleed a lot, and we could have a bleeding issue take place if we try to remove them. So they really have to be careful when they go in to try to remove malignant tumors. Another thing with this too is with malignant tumors, if we leave any of the cells behind, they could easily grow back into a tumor in that particular area. So when we look at classification of neoplasms, when we look at their tissue of origin, for a benign tumor, we put the tissue name, and then a lot of times we add oma to the end. So like osteoma, that was going to be the tissue of origin was the bone, and it has a benign tumor. Lipoma, when we look here, lipo or lipase, anytime you see lipid, that's where we're talking about fat. So a lipoma is an issue with the fat tissue. When we look at the malignant tumors, that's where they get named again by their tissue of origin, but they're going to be a bigger issue. So carcinoma, okay, epithelial tissues, sarcoma, connective tissue, lymphoma, which is lymphatic or blood, and then also leukemias, which we talked about. Now there's some others that are part of this. We sometimes see that gliomas are put in here, and that's going to deal with the brain a lot of times, but they don't really fall sometimes into the malignant tumors when we talk about gliomas, because they stay in the brain. They don't spread that much, but they do cause severe damage. So we can't really put them with the benign group because they are harmful to the individual. All right, so here's some origins and names of benign and malignant neoplasms. The cell of tissue origin, the name of the benign type of neoplasm, and then the malignant. So if you see that it's a glandular epithelium, we have an adenoma if it's a benign, but we have adenocarcinoma if it is malignant. Squamous epithelium, that's going to be mostly found like in the skin. We have an epithelioma, but then we have squamous cell carcinoma if it is a malignant cancer. If it's adipose or fat tissue, we have a lipoma, and then we have a liposarcoma. If it's cartilage, we have the chondroma, but then we have the chondrosarcoma. Bone is the osteoma, and we have the osteosarcoma. Glial cells are what we see in the brain, so that's the glioma, and then the blood is the leukemia. So this is just to give you an idea of how these cancers are named, and based on what you're hearing, is it benign or is it malignant? So again, comparing and contrasting the benign versus the malignant. You might think this is pretty important by now. You're going to have probably several types of test questions about this. Got to make sure that we know the difference. So benign tumors, the growth is going to be in a particular area, but not invasive or metastatic. It's normally going to be encapsulated in a capsule. It's normally easier to excise or to cut out, and it has a more limited growth potential. The malignant tumors are excessive without any regulation when we talk about their growth. Without structure or function of the normal cells, they lose all of their original structure and function. Surface area is not encapsulated, therefore it's going to spread out. Allowing it to spread out, it normally has fast growth, and it outpaces all of our normal cells, taking over and invading that area. All right, so if we take a look here, you can see that we would have kind of what normal cells would go through the process of doing, okay? And then we see the cancer cells, see that there are issues, especially when we look at the nucleus in a lot of these particular cells as they start to see issues and damage that's taking place. These cells tend to start to be larger. They also then will start growing uncontrollably in the sense of dividing, okay, kind of not caring about those checkpoints that we see normally in the cell cycle. Okay, they don't check their DNA because the more mistakes, the actual better it's going to be when we talk about cancer cells. So if this was to continue, we would see with the normal cells, they continue to do their just normal thing, spreading out, growing in a very structured way, whereas the cancer cells do not. Okay, they're dividing uncontrollably, they're becoming a lot more disorganized, the cells are misshaped, their function is not there like it was before, because now their whole goal is just to become a tumor. They're just there to take up more space, use nutrients, get larger. Okay, they're not there to do their original job anymore. So again, here's another comparison in a chart form. I'm trying to give you multiple ways of kind of studying the difference between benign and malignant. So when we look at benign, it's got slow, it can have some expansive type of growth, but it's going to be slow. The appearance is normally pretty symmetrical. It is going to have a capsule. The tissue present within the tumor does resemble the tissue of origin. The cells are still differentiated, meaning some of them may even still do the job that the original tissue did. And the surface tends to be more smooth. And you can see the picture here, down here in A, you can see that it's growing, but it's going to grow more symmetrical and it's encapsulated, expanding more slowly. With the malignant type of neoplasms, they're fast growth, invasive, metastatic, they're spreading to multiple areas. The appearance is more crab-like with those extensions that we see. There's no capsule. It does not resemble the tissue of origin. These cells are now undifferentiated. They do not perform a specific job except to take up space like we talked about. And the surfaces tend to be more irregular. They may start to ulcerate and even hemorrhage due to those new blood vessels that are present. All right, because you can see that the benign is still very organized compared to the malignant, which is not. It's just chaos. So this brings us to kind of doing a comparison of hyperplasias and neoplasms. When we look at this, there's going to be some similarities and some differences. So we need to remember what hyperplasia means. Hyperplasia usually is going to be a growth of cells, and this occurs in response to a stimuli. The growth, though, stops when the stimulus stops. Okay, so when we look at hyperplasias, they could be caused by a number of things. So like tissue irritation on your skin can cause a callus to form on your foot. So that's the part that, you know, like when you go to the get pedicures or whatever, they want to scrape off your calluses. We also see that's what can happen here, like if you were to use bars a lot, whether it's weightlifting or if you were like on a jungle gym. We also see that callus starts to form if you play a stringed instrument like a guitar or something like that, because of the strings pressing and irritating that skin. All right, and so when the irritation goes away, though, we see that the tissue goes back to normal. Okay, so that's what we look at for a hyperplasia. So some similarities between hyperplasias and neoplasms is that we do see that there's going to be an overgrowth of cells. Okay, no matter which one we're looking at, there's an overgrowth of cells. There's an increase in the size of the tissue. Okay, they can actually produce masses, which can be identified. Now, they can be identified based on if they're hyperplasias or neoplasms. All right, so we can do some tests and we can identify them if they're one or the other. Now, the difference, though, is the cause. Hyperplasias actually have an irritation or cause that triggered them, and the extent of the growth is limited. Whereas neoplasms, the cause, we may not know exactly what the cause is. Okay, there could have been a cause that caused a mutation in the cells, but the extent of the growth just continues, especially when we're talking about those malignant neoplasms. All right, so let's focus in a little more on the development of those malignant neoplasms, what we would call cancer. Okay, so let's take a little closer look. Now, there are a number of ways that development of cancer can occur, but most of the time we see there is going to be a genetic mutation that's taken place. The DNA has been mutated enough to where the cell does not respond to the normal type of restraints, the normal types of limitations that are put on our cells. Okay, they bypass all of that and they start growing uncontrollably. Now, this genetic mutation could be due to radiation. Okay, lots of different radiation type of issues could mutate DNA, things like UV rays from the sun. We also see like X-rays, certain jobs where you're exposed to even higher concentrations of waves, whether it's like gamma rays or something like that. Radiation could be the culprit. We also see that some viruses can actually cause mutations within cells, and these mutations then can cause the cells to become cancerous. We see this specifically with cervical cancer with certain strands of HPV, the human papillomavirus. There's also other things we come in contact with that we would consider to be carcinogens. Carcinogens are things that potentially mutate our cells. They're cancer-causing agents. And some stuff we've actually been able to identify that they are this. So when we look at carcinogens, we know that like smoking is one of them. Smoking on a regular basis and over a long period of time mutates the cells in the lungs and causes lung cancer. Okay, that is something that we know it has carcinogens that can cause cancer. Certain pesticides we know are linked to certain types of cancers. Now, there's other things that we may be exposing our bodies to right now that we don't know they cause cancer now, but maybe 10, 15 years down the road, we would know. All right, but those are different things that we come in contact with. There's also different chemicals that can cause cancers. We see that certain kinds of like hair dyes, they have been modified, maybe removed hopefully off of the market because of this, or at least some of them, because of the fact we found that a lot of individuals who were hairstylists or cosmetologists were having issues with certain kinds of cancers like bladder cancers and stuff, and it was actually tied to the chemicals that are used in a lot of the products that they utilize. All right, and so those are just some of the examples of things that can mutate that DNA and potentially cause cancer. Now, a carcinoma in situ, these are atypical cells that are in the epithelial layer of a tissue, but they haven't metastasized yet. They haven't broken through that basement membrane that epithelial tissue has. Okay, epithelial tissue grows and it's on a basement membrane. This is growing, but it hasn't penetrated that basement membrane and started to migrate. It hasn't started to metastasize yet. Now, this particular type of carcinoma we see is common in like the uterine cervix, the larynx, and the throat, and the mouth. The cancer can be avoided at this stage by surgical removal of the dysplasia, when we look at the dysplasia, that's going to be the abnormal growth that we see there, the abnormal hyperplasia that is present. If we can remove those, a lot of times we're going to see that we are going to be successful at preventing that spread from taking place. Now, invasion of precancerous cells can start to happen. If this happens, we see that this is the final stage of cancer development that starts to occur. These cells will continue to not worry about checking their DNA, allowing the genetic mutations to continue and to build up, which then they go from being precancerous cells to then cancerous cells. Those cancerous cells then a lot of times at this point are already starting to spread, and with that spread, the malignancy takes place. So now we have the malignant neoplasm, not just a benign type of tumor. Now, pre-screening is really important in some areas. We do see that in the uterine cervix, they can actually do some pre-screening for precancerous cells. They do that with a pap smear. Okay, so in some cases, we have things that can help us be able to catch this stuff early before it becomes a big problem, okay, before it actually becomes malignant cancer. All right, so guys, if we take a look here, you see we have the normal cells, we have the tissue surface, and you see the basement membrane is that line that's separating kind of the light pink from the darker kind of pinkish color. When a cancer first starts to develop, or a carcinoma first starts to develop, if it's still in situ, it means that it's not going through the basement membrane yet, but you can see that the number of cells has increased greatly, okay? And so it's increasing greatly, it's putting pressure, and eventually it's going to break through that basement membrane. And you see that when it's a full carcinoma that takes place. It has then spread through the basement membrane, and we're starting to see that it's going to start spreading to other areas where we would say then it is metastasizing. All right, so invasion and metastasis of cancer, that idea of it moving into new areas. Carcinomas and epithelial tissue neoplasms commonly do spread. And a lot of this has to do with that tissue is highly mitotic, meaning it's going to go through mitosis a lot, where we go from 1 cell to 2, 2 to 4, 4 to 8. And that was already, those cells were already doing that. However, those restrictions that were normally placed on those cells are now gone, and so they're not restricted based on not having room and things like that, so they'll continue to grow, which means spread takes place. Lymph nodes a lot of times are going to try to help filter out cancer cells. Now, we have lymph nodes that are strategically placed throughout our body to help trap things. They're going to help trap foreign invaders, help your immune system get rid of them. The problem is that sometimes cancer cells will use your lymphatic system as a highway. These lymphatic nodes or lymph nodes will capture these cells, and hopefully your immune system will destroy them. But sometimes they don't, and then now we see the spread of that cancer. Absence of lymph node involvement is actually favorable when we're looking at the idea of the prognosis for a patient who has cancer. If the lymph nodes haven't trapped any of these, the spread is going to not be as great. It means that it's not using the highway to move throughout the whole body. This can make surgical cure possible with certain types of cancer, being able to remove them all. If they're already using the lymph nodes, or lymph nodes have captured them, then just removing the original tumor is not going to help cure the cancer because it's already spreading throughout the body. Sarcomas actually shed their cells directly into the bloodstream. So they're going to use your cardiovascular system as a highway to spread those cancer cells. Now, when we look at this bloodstream metastasis, we see that there's some common areas where cancer cells will start to metastasize from their site of origin. This would be the liver, the lungs, and the brain. And a lot of times the secondary cancer site is what's discovered first. We end up finding like the tumors in the lungs, and then it's traced back to something else. Or we find the tumors in the liver and it's traced back to something else, or the brain. All right. And so then it's already metastasized into a whole new area. And again, prognosis is not that great. So guys, if we do a comparison of these carcinomas and sarcomas, the tissue is different. Epithelial tissue is the carcinoma, and the sarcoma is the connective tissue. Carcinomas are a lot more common than sarcomas are. Growth with a carcinoma tends to be a little slower in the sense of the spread, whereas sarcomas tend to be more rapid. And then carcinomas, the metastasis is primarily through the lymph or lymphatic system, whereas sarcomas are going to use the blood or the cardiovascular system. Now, when we get to cancer, one thing that we'll notice is that cancers a lot of times get a grade or a stage. So grading and staging are used for malignant tumors. They're used to help plan a treatment, okay? So to come up with a treatment plan for the patient and also predict the possibility of a cure. Is there going to be a chance that we can potentially cure this cancer? Now, grading and staging are a little different. Grading is going to determine the degrees of how abnormal the cancer cells are. Okay, so grading is based on how much do they look different than their original site, where they originally came from. So if they started as liver cells, how different are they from those liver cells? That's what gives us the grade. On the other hand, the stage is going to consider the degree of spread. How far has it spread from its site of origin? So again, if it started in the liver, how far has it spread from the liver? Okay, so that's the staging part. So for grading, since we're looking at the cells specifically, that's going to have to be where we take a biopsy, okay, of the tissue, and we're going to have to look at it microscopically. That way we can end up doing a comparison. The more different the cells look, or the more undifferentiated the cells look from the original site, that's going to be where we would call it anaplastic. Those cells have become anaplastic. The higher degree of differentiation, the better the prognosis is. Tumors are then undifferentiated or anaplastic. They do not resemble the tissue of origin if they're considered anaplastic. So when we grade, we're going to use normally grades 1 through 4. And grade 1 tumors are the less aggressive and serious types of tumors, whereas grade 4 tumors are the most aggressive. All right, so grade 1 is better than obviously grade 4, and then you have the 2 in between. Now again, with the staging, that's going to be looking at the degree of spread. We can do this by looking at it through like x-rays or certain kinds of CT scans or MRIs. Biopsies may need to be done as well. Surgical exploration to help evaluate the spread may be done. And a lot of times these guys again are going to be staged from 1 to 4. So we have stage 1 all the way up to stage 4. Stage 1 means that spread hasn't really happened yet, whereas stage 4 would be that it would be very widespread through the body. So they use faces here because it's easy to start to see the changes. So I have the normal one and it's divided into 2 and they looked identical, very similar, exactly the same as the original face or cell. With the hyperplasia, you see that it's the same thing, but there's just a higher number. There's more of them. Instead of just 2, there's now 4. In a dysplasia, we see that the cell size, shape, and even organization starts to change. If you'll notice in this case, the faces are larger, they're getting bigger, and there's more disorganization that's present. In metaplasia, we see a change that's taken place. So they're showing you that there's a change based on that face that's happened here. All right, the hair's different, the face is a little different, the cell or the face is even a little larger. In a neoplasm, there's new cells. They are not like the original cell that we had before. These faces look totally different. They're different in color. They're different in shape. They're different in what parts are present. And so that's what we would see more for a cancer cell. And so this is what we would look at a lot of times if we're talking about, especially grading, because we're grading to see how different the cells were from the original. So again, let's talk a little bit about causes of cancer. For many cancers, the cause is actually unknown. We're not really sure. We're not sure how to pinpoint exactly how that cancer developed. However, carcinogenesis, that's the formation of cancer, progresses pretty slowly. It may start and stop throughout the lifetime of the individual, and it may even be reversed a little bit during certain times where your immune system comes in and helps kind of keep it in check. And especially when we're younger, we see that this is happening because our immune system is good. Our body is constantly evaluating and doing surveillance and making sure that things are looking more correct or right in our body. The issue though too is as we age, Every year, we're putting more stuff into our body that potentially could cause cancer. We're exposing ourselves to more things that could cause cancer by the air we breathe or the water we drink or things like that. And so because of that, when we're older, we kind of have a compounded effect of things that have happened to our body, besides the fact that our body's getting tired and the cells are starting to wear down. Prevention and cure frequently depends on finding the initiating agent. If we know exactly what's causing that cancer to develop, then we can have a better chance of treating that and also potentially curing it. So chemical carcinogens could be one of those things where we would want to remove the carcinogen. We want to get rid of that. And so we would know what might be triggering it. We want to remove that from the patient. Hormones might actually increase the growth of certain tumors. We found that especially with breast cancer and types of like ovarian cancer or cervical cancer or uterine cancer, a lot of times hormones are part of that, estrogen. And if we can deprive those cells of that estrogen, then those cells don't grow as well as they used to. Okay, so hormones might be part of that. We might also see radiation. What's weird is radiation causes cancer, but then we also use radiation to help treat cancer. All right, we use radiation to help kill the cancer cells, but we want to pinpoint where we need to put that radiation. We don't want to give it to the whole body because that could then cause development of cancer. Some other causes we saw could be viruses. Some viruses potentially trigger cells to mutate and start to develop cancer-wise. Again, we see this with HPV. We've also seen that the Epstein-Barr virus is linked to Burkitt's lymphoma. Okay, it's a type of lymphoma. We also see that hepatitis B is closely linked to liver cancer. So we do see there are some viruses that could potentially have been the trigger. Also, you could have a genetic predisposition. This is one reason why when you go to the doctor, they have you fill out the history. They have you fill out the history that says, okay, how many individuals in your family have had cancer? What types of cancer? Who were they? Because the closer they're related to you, the higher chance that you may carry some of those genes, and you might have a genetic predisposition. This does not mean you will definitely get that cancer. It just means you might have a higher risk. There's also other personal risk behaviors that we do as just individuals. One of these is our diet. Our diet can sometimes help, but it also a lot of times hurts in the idea of causing cancer to develop. Some of these could be food additives that have been added to our food. This is why a lot of times in certain countries, they will actually outlaw certain additives or certain things that make food have a longer shelf life. We also see that make sure you have fiber in your diet is important. People who have a lack of fiber tend to develop, especially intestinal type of cancers more often. Also, other personal types of behaviors would include things like smoking and tobacco use, because we know that those are directly linked to certain types of cancer, especially in the mouth or in the lungs or respiratory system. Sexual behavior. We do know that a lot of these cancers are, especially of the reproductive system, are linked to sexually transmitted types of infections or diseases, viruses, or even bacteria. And so sexual behavior could also put you at a higher risk of developing some of these. And then also alcohol use. Cancer of the mouth, throat, and esophagus occurs more often in people who smoke or consume large amounts of alcohol. Alcohol has also been proven to cause issues with the liver, which then could potentially cause the liver with other kind of exposure to other things to start to cause more mutations. Recent studies have actually shown a higher incidence in breast cancer in women who drink more than 3 drinks per week. So there could be a link there with breast cancer. And so not saying that alcohol can't be taken at all, but alcohol use when it's over and above could potentially cause more issues. So because of this, are there some things that we can do that help us prevent cancer? Okay, so there are some, especially when we talk about our individual type of risk factors, our personal risk factors, there are some things we can modify. So don't smoke. Okay, yeah, easier said than done, but if you can stop smoking, you're going to reduce your risk greatly. Limit your alcohol intake. Protect your skin. Protecting your skin from excessive sun exposure is going to help reduce your risk of skin cancer. All right, when we look at this would be like wearing sunscreen, wearing UV protective clothes, that sort of thing, a hat, sunglasses. Another one is to refuse needless x-rays. If it's not needed to have that x-ray done, then we don't need to have it done. If you have to have an x-ray over and over and over again, you're increasing your exposure to things like that. All right, and so we need to be careful about how those are used. Avoid heavily polluted air. When the air is very heavily polluted, it's going to contain more of those carcinogens. We see this in like when smog levels are a certain amount and things like that. We want to not use that. We want to have filters that help with our air, that sort of thing. Follow labels when using things like pesticides and chemicals, especially if they tell you to use it in a well-ventilated area. Make sure you follow that, because if you're breathing in those fumes when it's not ventilated and they're higher concentration, ultimately it could cause more damage. Maintaining a healthy body weight. Again, easier said than done, but if you can do that and you can maintain a healthy kind of diet as well, like kind of using the food pyramid, there's a reason why that was developed. Those types of things could help as well. Regular breast assessment for women especially. This is done, you can do this yourself. You can look it up online. You can ask your doctor about it, but you should be checking. But also making sure that when you go to the doctor for your yearly appointment, that you're also having that breast exam. This is going to help us catch things a lot earlier. Okay, we want to catch things earlier than later when we're talking about cancer. And then exercise regularly. And guys, when we talk about this, it doesn't have to be like really extensive exercise. It's not saying go run a marathon every day. It's just as little as 30 minutes a day that gets your heart rate up can be super beneficial for your body. Because your body as a whole, but also in the prevention of types of cancer. Other preventative measures that we can see is routine HPV vaccination for boys and girls. An issue with this that I have deals with getting it done early on, because sexual partners are one of those things that not all individuals have multiple sexual partners. Their risk is not always increased. So don't necessarily think this is something that has to be mandated by like schools to enter into school. But I definitely think that parents should be able to decide as well with the child, and especially when the child gets to be a teenager and a young adult, to potentially see if this vaccination is something that they would need or would like to have, because it does help prevent some issues. Now, the problem is the vaccine doesn't cover all HPV strands, and it doesn't necessarily cover all the ones that cause cancer, but it does reduce your risk. Regular checkups by a physician are also super important. This again is the clinical breast exam for females, and maybe even having to have a mammogram done. We see a pap smear for females as well. That's checking out the cervix for abnormal cells. Prostate exams in males are important because prostate cancer is a big deal. And then rectal examinations for male and females, especially when we start to get to a certain age. Colonoscopies are super important. This helps be able to catch potential colon cancer early on and prevent extra complications that may occur. And of course, that also makes it where the patient hopefully will have a better prognosis if we catch the cancer earlier. So any of these preventative type of measures are going to be beneficial in catching things early. Earlier they're caught, better prognosis for the patient. All right, so let's talk a little bit about the frequency of cancer. Guys, cancer is the leading cause of death in the United States. Now, this is all types of cancers put together, but the cancer incident rate is higher in men than it is in women. We do see that it affects people of all ages, both male and female. The most common types of cancers that we see is a basal and squamous cell skin cancer. And basal and squamous cell skin cancer, if we're monitoring it and we're watching it earlier on, it does not spread very quickly, but this is especially seen in older individuals, and you might have heard this where they had to go to the dermatologist and they're like, yep, gonna go get more of my cancer carved out. That's these types of cancers a lot of times. The most common, excluding skin cancer, so we're taking skin cancer out of the mix because it is the most common, is going to be followed by lung, colon and rectal cancer, breast cancer, and prostate cancer. All right, so how do we diagnose cancer? What are some of the warning signs that we should watch for if we're going to be kind of looking for cancer? Well, one of the things we want to watch for is a change in bowel or bladder habits. Are we seeing a huge change in this? Now, this may not be cancer, but it could be telling us something else is going on. And so it's important that our bowels stay consistent as well as our bladder habits. If those start to change greatly, you should go get checked out. If you have a sore that just will not heal, it does not heal, it could be an issue. Okay, it could be a type of cancer. Unusual bleeding or discharge from certain areas, and this is going to be any kind of opening. So this might be like unusual bleeding or discharge in your mouth. If we're talking about like your gums, it could be discharged through like the vagina or the urethra or the rectum. Those are things we would all want to kind of get looked at. If there's a thickening lump in the breast or even elsewhere in the body, that could be an indication of a type of tumor that is forming. If you have indigestion or difficulty swallowing, and this continues to progress and get worse, get checked out. Obvious change in a wart or a mole. Okay, warts are a type of virus, but if we see that you've had it for a while and it starts to change in its size, shape, color, same thing with a mole, size, shape, color change, need to get it looked at. If you have a nagging cough or a hoarseness that's present. Now, prognosis is best if we can catch this stuff early. So routine screening is super helpful. So going to the doctor, a lot of times we don't go to the doctor unless we're in pain. We're hurting. Okay, but there are certain doctors we should go see for those routine type of checkups. Okay, it's important to keep on top of that stuff. A lot of time cancer is found accidentally. It wasn't something we were looking for and we accidentally found it. However, once it's discovered, a biopsy may need to be done. The biopsy helps us be able to determine how far the cancer is or even if it is cancer. Okay, so a biopsy may need to be done to remove some of that tissue and check it out. Okay, so we can look at what is actually going on. So what are some signs and symptoms of cancer? A lot of times patients who have cancer, have developed cancer, they have a lot of pain that comes into play. There's normally also a type of obstruction. Something's being blocked, especially when we're talking about like the intestines. This is why they might have severe indigestion or their bowels may be messed up. There may also be some hemorrhaging or bleeding that takes place. The patient may also be anemic because they're bleeding, and the bleeding might be a little slow, like a slow drip from a faucet, but over time that adds up and it causes the patient to become anemic because you're not replacing that blood quick enough. It could also cause a fracture to take place. A lot of times if cancer is developing in the bone and the bone starts to get weakened around that tumor, it could break and a fracture takes place. We may also see an infection move in, especially if our body is busy trying to investigate this cancer and fight cancer. You might see that infections come in. And then also cachexia. Now, we talked about cachexia in another video, but this is that wasting away that starts to happen. You're not hungry, you may not be able to keep things down, and the body is just wasting away, okay, because it's not getting the nourishment that it needs. Now with treatment, there's different options that are present based on the stage and grade of the cancer. Sometimes the only treatment available is what we would call palliative treatment. This is to prevent pain and discomfort for the patient, but it does not seek to cure the disease. The cancer is already so progressed that there's really nothing we can do except for making the patient comfortable. We do see that there are some treatments that can try to help prevent the start of cancer or prevent the start of the disease. Some are preventative types of things. Okay? And a lot of those are going to be especially looking at those preventative measures with certain screenings. In other cases, surgery may need to be done for treatment. We may need to excise or remove as much of the cancer as we can. Chemotherapy is another option. Now, chemotherapy is where we're going to see sometimes they're in combination. The patient had surgery to remove what they could, and then they had to undergo a series of chemotherapy treatments. Chemotherapy is going to be where we're going to use drugs. And guys, this is the thing. Anytime you see the word chemotherapy, we associate it with cancer. But really, if you're taking any kind of medication for something like high blood pressure, cholesterol, headaches, you're actually doing chemotherapy. You're using chemical drugs to help with the therapy of your issue. Chemotherapy is using very high intense types of drugs to help kill off the cancer cells. A lot of times this also makes the patient very sick and vulnerable while they are undergoing these treatments. Another thing that might be used in combination of surgery and chemotherapy is radiation. Radiation treatments are where we're going to use high radiation waves into a certain area where the cancer is located. This is going to be very concentrated. We're not going to do it on the whole body. Okay, we're going to concentrate that radiation into a particular area. And in some other cases, we may use hormone therapy, especially when we're looking at prostate type of cancers or even breast cancers or other cancers that affect the female reproductive system. Hormone therapy may need to come into play to help with treatment of those types of cancers. All right, so that finishes up our video here of neoplasm. If you have any questions, please feel free to ask, and happy studies.